Hi. Do you know that according to the American Diabetic Association that there are 26 million people in the United States with diabetes, and there are 79 million people with prediabetes. And in the year 2007, 230,000 people died from diabetic-related death. My name is Courtney McKinney, and today I'm going to be showing you how to properly use an insulin pump to help control your diabetes. One kind of insulin pump is this beeper-sized device that has pre-filled insulin cartridges. The benefits of these pumps are help better control your blood sugars, they help stop your lows, free your lifestyles to be able to do what you want, convenience, and of course, limited shots. Instead of having to do 5 to 6 injections throughout the day, you now only have to do 1 injection every 3 to 4 days. To help me demonstrate how to use these insulin pumps is my friend Casey. Casey has been a diabetic for 17 years, and in the last year has started using an insulin pump. Casey, how has this insulin pump affected your life?
It's changed it a lot. Instead of taking 7 shots throughout my entire day, I have 2 small kids, and now I can eat when I want. If the kids' schedule takes up my time and I have to skip a meal, it allows me to do so without low blood sugar or having to eat snacks or anything like that. So it's totally changed my day.
The nice thing about these beeper-sized devices is they come in many colors, and they're also easily to hide on you. You can put them in your pocket, you can put them on your belt buckle. For girls, we can even tuck them in our bras. It's very convenient. Along with your insulin pump, your doctor will also give you the supplies to properly connect your infusion set to your body. This is an infusion set. It comes with your tubing and also the needle and cannula to inject into your skin. Then you'll have your insulin, and you will also have your doctor will provide you with a prescription of the proper amount of insulin to draw up and load into your pump. You take your insulin, attach it on, and draw up. In Casey's case, it is 1 ml. We have drawn up 1 ml. It disconnects very nicely, and then it hooks into your tubing. From here, we're going to demonstrate on how to properly connect your infusion set to yourself. In Casey's case, she likes to do it in her abdomen. So she will properly clean her site with an alcohol Once pad. Casey's cleaned her site, while it is drying, she will take her insulin that we have drawn up in this cartridge and place it into her infusion pump. Once it is there, the nice thing about these infusion pumps is once she gets it connected to herself and we start it, it walks you through every step of the way. So once it's in, we then have to prime her tubing. With the tubing, it has a preset thing, and it says, "Are you disconnected?" Yes. You want to prime your tubing before you connect to yourself. So it's this, with it being disconnected from her, she will go ahead and prime her tubing. We then wait to notice a couple drips to come out, and that way we know that the tubing is properly primed.
Then it asks again.
Then it asks, "Do you see drops at the end of your tubing?" Yes, we do. These pumps are great because they literally are for anyone to use. They're so easy to walk you through.
It doesn't let you mess up. You have to push yes or no for it to continue.
So now that you're connected, now it says to go ahead and connect to your body. So now Casey has cleaned her site. It is dry. You have one of these insertion little discs that helps you connect. It inserts your needle, so you don't have to do a straight poke. It kind of just injects it into. It's really nice. So as she inserts that in there,
it's a lot less painful this way too.
Well, there you go. From someone who does it, it's a lot less painful, which is nice. You peel off these sticky parts. This is a nice adhesive tab that keeps your cannula attached to your body. She loads it down and pulls off the blue cap. That's a safety cap. Once it's there, then the needle is exposed with the cannula on it.
And it just stays in there until you push the devices, and it's spring loaded, and it will attach it to me pain-free.
As Casey picks her site, she'll go ahead and get ready to inject it. Just shown, she's injected her needle. She pulls that blue part off, and now what is left is this little plastic cannula. And that's all that's left in you. It is properly stuck to her. with the adhesive around. Her tubing is already primed with her insulin. And now there's a part where you hit to the next step and it fills the cannula that's in your skin with just a little bit of insulin without actually injecting you with a dose. Once it's properly attached, now she's ready to get her insulin whenever she needs it. Each time she uses it, all she has to do is program in the amount of carbs that she has eaten for a meal or going to eat for a meal, and it then calculates how much insulin she needs. Also, great thing about these devices is every time she checks her blood sugar, which she still has, you still have to check your sugars. Every time she checks her sugar, it automatically, if she is within, how far?
5 feet.
Within 5 feet of this device, her blood sugar device also sends her reading over what her sugars, what her blood level was at. So it automatically sends it over. Based on that and the amount of carbs that she will be consuming for her meal, it can properly give her the dose that she needs of her insulin.
And so now I don't have to do the math, and it gives you to the point, the decimal point amount of insulin. With drawing out of a syringe, you can't give half units. With this, it can give you 0.2 units or 0.5
Down to the
units. So
tenth.
it's
Awesome.
the exact amount you need, instead of having to guess and maybe eat a little bit or not eat for a while so it can correct your blood sugar.
These things are great.
Mine fits right up there. I tuck the tubing, you can't see it, and it's hidden.
Now she's ready
Nobody
to go.
even knows.
And a mother of two is awesome. She can go to all their games, do all their dance recitals, and not have to worry about having to stop and go check her sugar and give herself an injection. She now can go about her day getting the insulin doses that thank you for listening while I walked you through how to connect your infusion set and use your insulin pump. Hope you have a great day.